In the field of beta cell replacement, we are really in a good position, I have to say, because we have now at least 2 cell products derived from pluripotent stem cells under evaluation in phase 1-2 trials in the world. And they were able to provide the evidence that they can really work. So starting from pluripotent stem cells, you can differentiate insulin-producing cells ex vivo and then transfer these cells in human, and they can produce insulin. They can do this in a good way. I mean, they can respond to the glucose producing insulin, but also we have the first evidence that you can provide a clinical benefit for the recipient. So we are really in a very exciting phase of the story. So stem cells is probably one of the things that can make the difference in the next years in our field. On the other hand, there are still some problems that has to be solved. The first one is that is related to the recognition by the immune system. Type 1 diabetes is an autoimmune disease. So if you use autologous sources, for example, iPS derived from the single patient's cells, they will be recognized by the autoimmune reaction when you will bring back in the patients, because autoimmunity remain in this subject even after many years from the disease onset. On the other hand, if you use allogenic sources, you still have problem because you have the allo recognition, typical rejection that we know very well from the organ transplant experience. So the major discussion in the next years is to how we can do this type of implantation without using immunosuppression, without having immune reaction. And so the idea is to build a sort of invisible cells, taking in consideration that invisible cells probably can work, okay, but they are also really a little bit dangerous, because if something will go wrong in terms of maintenance of the phenotype or transformation in neoplastic tissue, if they are invisible, it's quite difficult to clear them from the immune system. So now what is ongoing is something that is associated with the immunosuppression. So we can do this by using allogenic sources. If you want to do without immunosuppression, now the problem is not biological, it's most related with the safety. Because if they are invisible, they can escape the immune recognition, and if they can do a lot of damage eventually.